Bismillahirrahmanirrahim. Hello everybody. So a 36-year-old woman gravida 2 para once come to the office at 32 week of gestation with dull low back pain radiating toward the bilateral lower extremities. The pain is minimal in the morning but increases with activity and at the end of the day. She also noticed ankle edema and numbness in her feet at the end of the day. The patient has urinary frequency and nocturia, but no hematuria or dysuria. She did not have back pain in her first pregnancy. During that pregnancy, she received epidural anesthesia during labor and had a post-lumbar puncture headache after removal, which was treated with an epidural blood patch. Temperature is 36.7 centigrade, blood pressure is 120 by 80, pulse is 90. She has gained 20 kg in this pregnancy. On physical examination, the patient ambulates with a wide lateral gait. Walking forward or backward causes no change in pain level. There is no paraspinal or paravertebral tenderness. Deep tendon reflexes are 2 plus. The abdomen is soft and the cervix is long, close, and posterior. Which of the following is the next appropriate step in management of this patient? Blood culture, corticosteroid injection, erythrocyte sedimentation rate, MRI of the spine, neuroconduction study, reassurance and conservative management, strict bed rest. So first of all, this patient come to us at 32 week of gestation. Second, she experiences low back pain radiating to thighs, radiating to both thighs. Third, the pain increases with activity. Four, she also have ankle edema and numbness. And the fifth point is she gained almost 20 kg in her pregnancy. 20 kg in pregnancy. So the diagnosis of this question is: first, she came to us at 32 week of gestation. Second, she has low back pain radiating toward the thighs. Third, the pain increases with activity. Four, she also having the ankle edema and numbness. Fifth, she gained 20 kg in her pregnancy. So she is suffering from lordosis. And these all symptoms which she is suffering from is normal during the pregnancy, which is physiological changes during the pregnancy, because she experienced lordosis, in which the increasing weight of the uterus and weakening of the abdominal muscle causes the lordosis. So in these choices, the correct option is choice F, reassurance and conservative management. Why this option is correct one? Because low back pain is a common benign condition often seen in the third trimester of pregnancy. As already we know that this patient come to us at 32 week of gestation. Patient with low back pain typically have pain that radiated down the thighs, worsen with activity and improves with rest. This issue arises from exaggerated lordosis due to the enlarging uterus, weakened abdominal muscle and joint ligament laxity. Risk factors include a multiparity, a history of back pain, and excessive weight gain. As already know that this patient gained 20 kg and is normal and will resolve spontaneously. So first of all, the patient can then receive reassurance that the back pain is normal and will resolve postpartum. Conservative management is typically with behavioral modification. For example, wearing supportive shoes, using a firm mattress, heating pads, massage and analgesic are also beneficial. So come to the incorrect one. Blood culture, choice A. So blood culture are indicated when an infectious process is suspected. Choice B, corticosteroid injection. Corticosteroid injection can treat back pain from a herniated disc if conservative management fail. Choice C, erythrocyte sedimentation rate. So, an elevated erythrocyte sedimentation rate is associated with ankylosing spondylitis. Back pain characteristic of ankylosing spondylitis is worse in the morning and improves throughout the day. Choice D, MRI of the spine. So, imaging for back pain is typically with an MRI, but it is reserved for patient with back pain and neurologic deficit. Choice E, nerve conduction study. So a nerve conduction study is used to diagnose polyneuropathy without a clear etiology. Choice G, strict bed rest. So strict bed rest is rarely recommended in pregnancy due to the increased risk of thromboembolism and decreased bone mineral density. So come again to choice F. Why the choice F is the correct one? Because the symptom this patient is suffering from is she having the back pain which radiate toward her thighs. She also having the pain which increases with activity, and she having ankle edema and numbness of the feet. So this patient is suffering from lordosis because the risk factor for lordosis is increased weight, as we already know that this patient gained 20 kg during the pregnancy. So in lordosis during the pregnancy with increasing the uterus weight and weakening of the abdominal muscle causes lordosis. So this is a normal physiological during the pregnancy. So we will reassure the patient and conservative management